Welcome to PALS. It's Professor Anyanwu's Anatomy Lecture Series. In this place, it's our goal to make anatomy simple. If you're just joining us, you have not subscribed, we will encourage you to please be a part of this amazing anatomy family where we make anatomy simple. So in our lecture today, we'll be looking at series on gross anatomy of the arm. And in this part 1, we'll be discussing the muscles of the anterior compartment of the arm. In the second part of this lecture, we will consider the muscles of the posterior compartment, and also we'll look at the associated clinical correlates in the arm. So let's go to class. At the end of our lecture today, all my students will be able to 1. State the extent and components of the arm, be able to identify and name all the muscles that we see in the anterior compartment of the arm, and additionally we should be able to explain the innervations, we should explain the origin, the insertion and actions of these muscles in the anterior compartment of the arm. We will start with determining the extent of the arm. Severally we see the word arm being misused in different contexts. But in the context of our discussion today, the arm is the region of the upper limb that we see from the shoulder joint to the elbow joint. So here is the arm, here is the shoulder joint, and here is the elbow joint. And the arm is the region between the shoulder joint here and the elbow joint here. This is made up of many components. We'll be looking at the muscles, we'll be looking at the nerves and the blood vessels. Also, the bone of this compartment is called the humerus. Here is the bony component, which is the humerus, and then these are the muscles, and then we see the various nerves scattered in the various parts, lateral and medial regions, and then the arteries and then the veins. The arm is separated into 2 compartments. The 2 compartments are the anterior compartment and the posterior compartment. This is the anterior compartment of the arm. The diagram you're seeing here is a transverse section of the arm. Here is the anterior part and here is the posterior part. This division into 2 compartments is actually done by extension of the deep fascia, both laterally and medially. So here we'll be seeing another diagram. Intermuscular septa, the lateral intermuscular septum, the medial intermuscular septum. So this septa will give us these 2 regions as we noted earlier. Here we are seeing the muscles in the anterior compartment, and then here we are seeing all the components of the posterior compartment. We will start with the anterior compartment, and then this compartment is also called the flexor compartment. Why is it called flexor compartment? Because it is involved in flexion. All the muscles that we'll be discussing in this compartment are all involved in flexion. And where is that compartment? We have this compartment. Now we have 3 muscles here located in this region. They are the biceps brachii, the coracobrachialis, and the brachialis. We use this mnemonic BBC to help us remember them. What does B mean? Here is the first: biceps brachii, brachioradialis, and coracobrachialis. The nerve of this compartment is the musculocutaneous nerve. If you remember the musculocutaneous nerve, it is the nerve that is coming from the lateral cord. It's actually the main branch of the lateral cord. The artery of this compartment is the brachial artery. Now here is the brachial artery. We are going to start with these muscles, and the first muscle we'll be starting with is the biceps brachii. For each of these muscles, we'll be looking at the origin, the insertion, the action, and innervation. So let's start with biceps brachii. Here is the muscle called the biceps brachii. From the name biceps, we will have the understanding that it has 2 heads of origin. One head is here, another head is here. What are these heads? we have the long head and we have the short head. This muscle forms the bulk of the muscle that we see in the anterior part of the arm. It forms the superficial bulk we see in this compartment of the arm. That's the anterior compartment. Usually, it will partially cover all the other muscles in this compartment or completely cover them. The biceps brachii is the superficial muscle of this compartment, completely covering or partially covering the rest of the other muscles. So we have two heads. This muscle has the long head and the short head. The long head will pick in origin from this part of the scapula. At this point of the scapula, that's called the supraglenoid tubercle. And the short head will pick in origin from this part of the scapula also. That is this part of the scapula, which is the tip of the coracoid process. Here is the coracoid process. So both heads of biceps brachii, the long head and the short head, pick origin from the scapula, long head from the supraglenoid tubercle, and short head from the tip of coracoid process. Let's also look at this muscle again. So here is the short head that we said picks origin from the tip of the coracoid process, and that is that tip of coracoid process. And here is the long head picking origin from the supraglenoid tubercle and additionally from the glenoid labrum. The glenoid labrum is actually the rim that we see lining the glenoid fossa. We are going to additionally look at the cause of the long head of biceps brachii. Now, this tendon of origin from the supraglenoid tubercle and the glenoid labrum will pass through the capsule of shoulder joint. So here is the capsule of shoulder joint, and you can see that tendon of origin running through the capsule. Because it runs deep to the capsule, we say that this tendon is intracapsular. As it passes through this tendon, we also see it passing through this part of humerus, that is between the two tubercles of humerus. If you can see, remember the osteology of the humerus, here is the lesser tubercle of humerus, and here is the greater tubercle of humerus. So we see this tendon passing between these two tubercles, and this groove where it passes through is called the intertubercular groove or intertubercular sulcus. And of course, as it passes through this groove, we expect it to also be running over another muscle. What's the name of the muscle? Latissimus dorsi. Latissimus dorsi is one muscle that we see that be giving its insertion on the floor of this intertubercular groove, while the long head of biceps brachii will run across it as it goes to join the other belly from the short head of biceps brachii. So by the time the two tendons will come, they will form their different bellies. So this is the tendon emerging from this sulcus, that's the long head, and here is the tendon of the short head, and here they form their different bellies that will fuse and then form a common muscle belly. We will next consider its insertion. Just as we noted in its origin, it inserts into two different places. Now, in our diagram, this is the elbow joint, and then here is the radius, and this is the ulna. Now, these are the common bellies. Now, this is the common tendon. Now, this tendon actually inserts at a part of the forearm that is in the radius, and that part of radius where the tendon of the biceps brachii inserts is called the radial tuberosity. That's this bony projection here. So the tendon of the biceps brachii inserts at the radial tuberosity. But there is this part of the tendon that moves medially. Remember, the radius is on the lateral part and the ulna is on the medial part. So this is the tendon coming down. The tendon moves, the lateral part of the tendon moves down and inserts on the radial tuberosity, while the extension from the tendon called bicipital aponeurosis. Here is the bicipital aponeurosis. So bicipital aponeurosis will move medially, and then this part will attach to the deep fascia in the medial aspect of the forearm. Here is the forearm. So this bicipital aponeurosis will attach with this deep fascia at this medial aspect of the forearm. So 2 points of attachment, one at the radial tuberosity, one joining the deep fascia of the forearm at the medial side. The action of this biceps brachii is actually many. We'll start from its action as a supinator to its action as a flexor of the elbow joint and also flexor of the shoulder joint. Because if you can recall from its origin and its insertion, it passes through these two joints. Proximally, it passes the shoulder joint, and distally, it passes the elbow joint. Now, we'll also look at the action of preventing upward displacement of the head of humerus. We're going to use very wonderful pictures to actually explain them. Let's start with its action of supination. Biceps brachii is a strong supinator of the hand, and then it is strongest when the elbow joint is flexed. This hand here is pronated, and then at this point we see the biceps brachii carrying its action of supination. This muscle is also a powerful flexor of the elbow joint. Here the elbow joint is extended, and then we see this action of flexion, which is done by the biceps brachii muscle. The next action we'll be considering is also the flexion, but this time at the level of the shoulder joint. This is flexion as it's done by the biceps brachii and other muscles, and here is the extension that we'll be talking about as we begin to look at the extensor compartment. The last action of biceps brachii we'll be looking at will be the action of preventing the upward displacement of the head of the humerus. This orientation of the muscle tendon will prevent upward displacement of the head of humerus from its socket here in the glenoid fossa. Here is the head of humerus, and this is the glenoid fossa, and this head has been displaced proximally, and this usually happens when there is a rupture of this long head of biceps brachii, and we'll be considering this in the clinical correlates of the region. As we noted when we started this lecture, we said that muscles in this compartment, anterior compartment of the arm, they are all innervated by musculocutaneous nerve, which we said is one of the major branches from the lateral cord of brachial plexus. So here is part of the lateral cord, and then this is musculocutaneous nerve as it's piercing coracobrachialis and entering the anterior compartment, supplying the various muscles in this compartment. We'll be going to the next muscle in our discussion in this arm, and that is the coracobrachialis. Now, the coracobrachialis is a small, insignificant muscle, usually less noted because its functions are not so remarkable. Now, this muscle is seen in the upper part of the arm and the medial part of the arm. So here is the muscle located in the proximal part of humerus and in its medial part. We'll start with the origin. Here is the muscle again. When we discussed the anatomy of the origin of the short head of biceps brachii, you remember we mentioned that it picks origin from the tip of coracoid process. That means there are two muscles that are picking origin from this tip of coracoid process. The first one now is the short head of biceps brachii, and the second now we're mentioning is the coracobrachialis. So coracobrachialis alongside the short head of biceps brachii will pick origin from this tip of the coracoid process, and the muscle will move towards the medial part of the arm and will insert in this part of the shaft of humerus, which is the medial aspect of the shaft of humerus. So here at the tip of coracoid process is the origin, and here at the medial aspect of the shaft of humerus is the insertion of this muscle. The nerve supply of this muscle is the musculocutaneous nerve. That is the musculocutaneous nerve, And here we're seeing it piercing through the coracobrachialis, giving it its own innervation and passing through it to reach other muscles in this compartment. And this is at root C5 to C7. The action of this muscle is flexion. It flexes the arm. And it is also a weak adductor of the arm. Remember, it's medially located, so it's able to carry out the function of adduction. The coracobrachialis flexes the arm. This is flexion of the arm, and it also adducts the arm, and this is adduction of the arm. The last muscle we'll be looking at in our study of the muscles in the arm is the brachialis. The brachialis is actually deeply located in the arm. Remember, while we will see the coracobrachialis at the upper part of the arm on the medial side, brachialis is seen at the lower part of the arm in the anterior part. So let's look at the picture. This is the brachialis seen at the lower half of the arm at the anterior part. Here also is the brachialis. So this muscle occupies this lower part of the arm. We will look at the origin and also insertion. It takes origin from the front of the lower half of the humerus. And if we remember, those deep fascia are the medial and lateral parts of the humerus, which is said they are thick enough, and we call them the intermuscular septa because they are separating two muscle compartments. So it also picks origin from the adjacent intermuscular septa from the medial side here and from the lateral side. So the origin of brachialis is lower half of humerus and then adjacent sides of lateral and medial intermuscular septa. Its insertion is on the ulna, and the part of ulna it inserts is this process of ulna, which we call the coronoid process of ulna. This is the coronoid process of the ulna, and this is its insertion here. The nerve supply is musculocutaneous, and it is a powerful flexor of the elbow joint. This is the function of flexion as is done by the brachialis. By way of summary, let us look at some of the things we've covered so far. In the arm, we said we have two compartments. And in this compartment, we have the anterior or flexor compartment, and we have the posterior or extensor compartment. And we said that all these compartments, they have their nerves, muscles, and blood vessels. In the anterior compartment, we said we have three muscles. We used BBC, and those muscles are biceps brachii, brachialis, and coracobrachialis. And we also said that the nerve of this compartment is the musculocutaneous nerve. In location, we said that the biceps brachii is seen superficially, completely covering the brachialis muscle and partly covering the coracobrachialis. Then for the coracobrachialis, we said it is seen at the proximal part of the arm on the medial side, and then for the brachialis, we said it is seen at the distal part of the arm at the anterior part. We looked at the various origins, and we said for the origin of biceps brachii, we mentioned two parts. We mentioned the long head picking origin from the supraglenoid tubercle and also the glenoid labrum around the edge of the shoulder joint. For coracobrachialis, we said it picks origin alongside the short head of biceps brachii, and these two tendons pick origin from the tip of coracoid process. While for the brachialis, we said it picks origin from the anterior surface and the adjacent intermuscular septa, that is the lateral and medial intermuscular septa of the arm. So these are the origins of all these muscles, and for their insertion, we said that the biceps brachii also had two insertions. The main tendon went to a part of radius we call the radial tuberosity. That extension from its tendon, which we call the bicipital aponeurosis, we said it inserted in the deep fascia of the forearm. For the brachialis, it inserted on the other bone in the forearm, which is the ulna. Which part of the ulna? The coronal process of the ulna. So while these two muscles are going down to the forearm, the coracobrachialis did not get down to the forearm. It stopped at the middle of the shaft of the humerus at its medial part. So these three muscles shared their insertions, one at the humerus, the other at the radius, and the other at the ulna. So this is where we come to the end of this first part of our lecture. We just considered those muscles in the arm. If there are questions, comments, or suggestions you would like us to know, please drop them in the comment section for us. The part 2 of this lecture will be on the muscles of the posterior compartment, and then we'll also consider the associated clinical correlates around this region. If you consider this material helpful, I will encourage you to please subscribe, like the video, and share it to your friends, that it will also be helpful. And together, we will build this unique anatomy family, the PALS anatomy family, where we make anatomy simple. I'm your tutor, Professor Anyanwu Godson Emeka. Make sure I see you in my next video. Let's move to the part 2 of this lecture series.